Good morning and welcome to Tuesday's Toolbox Talk. And this one we're going to cover the plan, do, check and act for health and safety. So we need to understand the importance of the PDCA cycle in improving health and safety practices at the workplace and ensuring a safe environment for all employees. So the PDCA cycle is a continuous improvement model that helps to manage and improve processes, including health and safety systems in the workplace. It is a structured approach to solving problems, managing risks, and ensuring that safety measures are effective and always evolving. So the cycle is broken down into 4 stages. These are the plan, the do, the check, and the act. And each stage builds on the last, so helping you to make meaningful improvements. So the first one then is the plan. This is where you set objectives and identify risks. So in the planning stage, you identify what needs to be improved and set clear, measurable objectives for health and safety. This is where you should conduct risk assessments. And this is to understand the potential hazards and risks in your workplace. Set objectives. So this is for improving health and safety. And these should be SMART, which is specific, measurable, achievable, relevant, and time-bound. You then plan actions. So this is to eliminate or control identified risks, ensuring that you adhere to all legal and regulatory requirements. So, for example, following all the guidance under the Health and Safety at Work Act. And then allocate resources. Ensure you have the right people, the correct training, the correct equipment, and systems in place to implement safety measures effectively. The second stage then is the do. So this is where you implement the plan. In the doing stage, you put your plan into action. So implement safety measures based on the planning stage. This could include things like installing safety equipment, conducting training sessions, or improving workplace conditions. These then should be communicated effectively. So ensure that all employers are informed about the health and safety measures and know what is expected of them. And this will be covered as part of your induction. Train your team. So provide adequate training to ensure workers understand how to perform their jobs safely and know what to do in the case of emergency. And then promote a culture of safety. You should encourage employees to report hazards, near misses, or unsafe practices. The next stage then is the check. So this is where we monitor and evaluate. In the checking stage, you monitor and evaluate the effectiveness of the actions you've taken. So this could be to review safety performances by regularly checking whether the safety measures have been successful in reducing risks and meeting your objectives. Conduct inspections and audits. This is to verify the conditions on the ground. Check if safety procedures are being followed and whether risks have been mitigated. Gather feedback from employees, as they are often the first to notice if something is working or is not. And then record incidents and near misses. These are critical in evaluating the health and safety program's effectiveness and identifying areas for improvement. The last stage then is the act. And this is where we make improvements and adjust if required. In the act stage, based on what you've learned from the check phase, you should review findings. So this will be from your checks, feedbacks and audits. And if things are not working as expected, you need to identify any root causes. You will then take corrective action. Now, this should involve revising your plan, introducing new training, or implementing new safety equipment. Update policies. So ensure that any changes or improvements to safety measures are reflected in the workplace policies, risk assessments, and these are communicated to all workers. And lastly, promote continuous improvement. The PDCA cycle is ongoing, and it's essential that always strive for better safety standards. Under the legal compliance and reporting in the UK, all businesses must adhere to various health and safety laws, and this could be the Health and Safety at Work Act, the Management of Health Safety at Work regulations, or the Control of Substances Hazardous to Health regulations. Ensure that your PDCA process aligns with these regulations to stay compliant and keep your employees safe. Regularly review your risk assessments and keep your safety policies up to date. So key takeaways from today's Toolbox Talk. The PDCA cycle is an essential part of managing and improving workplace health and safety. It ensures that health and safety measures are continually assessed and improved, which helps to protect workers and reduce accidents. And by planning, doing, checking, and acting, you create a safer and healthier work environment for all. Thank you very much.